started. Bill, they don't ever miss. How was lunch? Why don't we give a hand to our friends from Wellmark Blue Cross and Blue Shield who helped provide lunch today. And if you can grab your seats, we'll get going with the afternoon's presentation. Now, do I have to point this in any direction? I can point it anywhere. Point it at you. It has been one crazy ride. It has been one heck of a journey that we've been on together. And just thinking about today, we're about at the midway point of our journey. I don't know about you, take a trip. Sometimes at the midway point, you need a little inspiration. You're getting a little tired, getting a little upset with the kids in the back seat. Several years ago, I became fond of inspirational quotes, and I want to share some with you today that I think are particularly relevant and poignant for us. I like this quote a lot. Partially because back in the day, Lord McCall was pretty hot. Am I right? Wait a second, did I say that or just think it? Also, because this is a critical message for everyone in the room today. It is absolutely imperative that you not stand still. If you keep doing the same things, if you keep selling the same products the same way to the same customers, you will fall behind. And I will not like your chances at the end of the day. Disruption creates opportunity. And there will be winners and there will be losers. And the winners, I can assure you, will not be the agents who stand still with empty to-do lists and don't change anything as a result of what we've talked about today. The winners will be the ones that partner with GBL, find a new destination, and together with us, get there. We now move on to a quote from Alex Noble. And I'll be honest with you, this one is near and dear to my heart. Here's what I think it is telling us today. If you have allowed politics and the things that are being said and being done all around you, sometimes without your control, if you have allowed those things to put you in a crappy mood, then the bastards have already won. Don't give them that power. Success is not something that happens when we get somewhere. Success can start today. It can start today if we approach our journey with optimism and spirit and glad heart. I cannot with precision predict exactly where the journey will take us. But if we approach it that way, I can assure you we have a chance to win. This is my favorite writer. And for my money, the best writer in American history. I want to read this together. Whatever you do, you need courage. Whatever course you decide upon, there is always someone to tell you that you are wrong. There are always difficulties arising that tempt you to believe your critics are right. However, to map out a course of action and to follow it to an end requires the same courage that a soldier needs. Peace has its victory, but it takes brave men and women to win them. I like this quote for a lot of reasons. Obviously, it speaks to the importance of courage. It honors soldiers, which is a big deal to us at GBL. In my life, I have learned one thing about courage. And that is that true courage is not the absence of fear, but rather the triumph over it. The brave person is not the one who does not feel afraid, but he who conquers his fear. I get it. I get it. There's a lot to be afraid of. You'd be an idiot not to be a little bit concerned. But if you will embrace the journey with courage, together we will face down those fears. We will choose a new destination. And together we'll arrive there. So there you have it. We cannot stand still. Fill up your to-do list. Make reality change because of what you heard today. Get involved with a product and market segment that you hadn't before. Don't stand still. Move forward with spirit and optimism and courage. Okay, here's what we're going to talk about today. It's a simple agenda. Where have we been? Where are we now? Where are we going? Even Aaron Burke can understand this agenda. Where have we been? I hope what you've seen and read and understood is that GBL has been right there with you as we try to do the right thing, which is to protect your role and your clients. Those of you who have been around for a while know that a defining mission at GBL is to do the right thing. It's not just a slogan on the wall. It drives decision-making. It helps us determine what types of support, what products, what market segments we want to make available to you. And it was that mission that also drove us several years ago to decide to become a leader in the debate about healthcare reform and, importantly, the role that you will get to play. And I don't mind telling you, by the way, that with respect to our so-called peers, it has been a lonely battle. I don't know how many meetings we've attended with industry leaders. I don't know how many meetings we've attended with state representatives, how many times we've met with the governor or congressional leaders, how many times we've been published in the newspaper, appeared on the radio. I don't know how many committees my staff and our allied agents serve on trying to influence the debate. But I do know how many times I've seen leadership from another GA at any of those events. The answer is exactly 0. You learn a lot about an organization when the chips are down. GBL does not have its head in the sand. We are right there with you, fighting with and for you as this debate continues. And yes, Mutual Med and PIPAC, I am talking about you. Did you think I wasn't going to name it? All right, so where have we been? Well, about a year ago, this is where we were. We launched American Needs Agents at this very meeting last year. It told the story that you do and what you do on behalf of your clients, and importantly, it had a petition that we encourage folks to sign. Thank you for your support. We had more than 1,200 people sign that petition, and later, as you'll learn, we delivered it to representatives, and I think it made a difference. In December of 2001, this editorial was published in response to something that the Secretary of Health and Human Services had said. Here's how the editorial begins. Of all the Pollyanna-ish nonsense being bandied about healthcare reform, the latest pronouncement from Kathleen Sebelius takes the cake. What is it that she had said that had got me so riled up? You'll like this. She said, health insurance exchanges will guarantee for the first time that all Americans have access to affordable care. As I asked in the article, how the hell will that happen? Nothing about exchanges, and in fact nothing in that law, alters the fundamentals of healthcare economics. The reason premiums are so high is because healthcare costs are so high. If 90 cents of every dollar that Blue Cross collects goes to pay a claim, unless you lower the cost of care, premiums will remain high. That seems like an easy calculation, although perhaps beyond the wisdom of Miss Sebelius. I have a reaction to what she said. What complete Nonsense. Nothing in that law will lower costs. I can tell you one thing exchanges might do. They might put me out of work and you out of work and cost your clients the opportunity to have licensed and good representation. And it's not just us in this room. We're talking about hundreds of thousands of agents nationwide. Talk about solving a problem that did not exist. If there's one thing about the healthcare system that has been working pretty well, it's you people in this room. Your clients have access to trusted, reliable information. But they want to replace you with government employees, who, as Mr. Van On mentioned, may not even be licensed. Later today, if you hear someone say, "Hey, crazy eyes," and you're wondering why they do that, this is why. I don't know how many newspapers in the state this is how my photo was written to. But I know it was that way in Storm Lake. Thank you, Lacey Barb, and Mike, point that out every time I say it. So yes, thank you. Who said that? Allison Peterson says, "Or crazy forehead." Great. And by the way, digitally, Heather, I do want hair added anytime you use my picture. Okay. We took that petition that we had done with American Needs Agents, and we met with the governor and the heads of the Senate and House minority and majority leaders on Iowa Insurance Day on the Hill. That was January 31st. There's me giving the governor a bribe, and he's putting money in his wallet. Where's my forehead again? Okay, sure. That's twice now, if you're keeping score at home. So anyway, we had a conversation about exchanges and specifically protecting your role as agents. And it's a very political and nuanced conversation that occurs around exchanges. We'll talk a little bit more later about where that debate sits today. But I do think we had an impact, and thank you for helping us do that. You may not be aware of this. This is really cool. We kept trying to get specific language passed, and we could never get any action on it. At the end of the legislative session, there's always this bill called the Standings Bill. It's like the cleanup thing. Anything you didn't quite get done. And this was a Hail Mary of the most amazing type, that we were able to get important language passed, the coalition that David and Joe and I serve on, that protects you more than perhaps you were aware. Here's how this works. As David said, the Affordable Care Act specifically prohibits navigators from being licensed the way we are. Am I the only one who finds that the height of hypocrisy? We have a government with a seemingly unsatiable desire to overregulate every industry, none more so than the financial services industry. And yet their very own employees, who navigators are likely to be, the law specifically prohibits you from acquiring the same license that private citizens who want to be insurance agents must have. I find that hypocritical. So here's what our law does, and I think it was tricky, and I think it was brilliant. We said, okay, you don't have to pass the insurance producer's test, and you don't have to get that license. You have to get a separate one, which is probably going to be pretty similar, I would guess. So you will, if you're a navigator, have to pass that test, and you will have to show financial wherewithal in the event of an E&O claim. Won't be E&O insurance, likely be a bond. And here's the most important part. Our law specifically prohibits navigators from doing anything that an insurance producer's license requires. So think sell, negotiate, bind coverage. This law is getting a lot of attention nationwide. The consumer groups are going haywire, certain ones. So we will see how the debate plays out. But this was signed into law by the governor, and it was an important win that we were able to achieve. Okay.
Pardon?
What's that? Okay. Hopefully you noticed that on September 5th, we issued our healthcare reform timeline. I want to talk about this a little bit, because our role as consumer advocates is to help our individuals and our group customers understand healthcare reform, and more specifically, to understand the decisions they have to make, what will affect them, and to give them counsel about how to ensure they're remaining in compliance with the ACA and maximizing their health benefits dollar. And to me, the way to do that is a little bit different than what I've seen from the competition. Here's one I like a lot. This is from Gallagher Benefit Services. This is their healthcare reform questions and answers for employers. It's like 150 pages long. Here's question 91. Does the list of women's evidence-informed preventive care and screenings include coverage for contraception? Blah, 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 blah. I think we ought to shoot for better. I think if I handed this to an employer, they'd say, really, what am I paying you for? I could read the law myself. And so our approach will be different. As you noticed on the timeline, we are highlighting for employers, these are the decisions you have to make. Here is advice about how to make them. Here are just some other things you need to be aware of. The next piece you'll see from us will indeed be a step-by-step guide. All of the decisions you need to make, special guidance about how to make them. I think that will make us different. I think that will make us better in the market. Hey, this was only a couple of weeks ago. By the way, who writes these headlines? I thought it was a suspenseful porno movie. This article makes the point, a factual point, a relatively simple factual point, that the age band restrictions as a consequence of healthcare reform will change from 5-to-1 to 3-to-1. And as a consequence of that, young people will get the shaft. They will pay deliriously high premiums. Blue Cross and Blue Shield believes several 100,000 will get increases of over 50% on day one, January 1st, 2014. I found the reaction to my article to be quite comical. I got many threatening voicemails, many threatening emails, and the level of debate on the Des Moines Register comment site was a little less than brilliant. But the thing about it was, people were disagreeing. You can't disagree with a fact. I didn't make it up. It changes from 5-to-1 to 3-to-1. Young people get hurt by that. Period. You could argue whether that's a good thing or a bad thing, but it's simply a fact. Do you like stories? I got a good story. I heard about this not too long. This is a good story. You wonder sometimes if you write something, and by the way, I write something for the newspaper whenever I'm really pissed. And so I was really pissed, and I wrote this, and I'm not making this up, in 38 minutes. It's a pretty simple article. And you wonder who reads it. Well, guess who read this? Senator Harkin. We got his attention. How do I know that? Because he took that article, got in a plane, flew down to Des Moines, and met with all the senior executives at Blue Cross and Blue Shield. Yes, this happened. And he said to them, "Is this true?" And they looked at him, and they looked at each other, and they said, "Yeah." And as the story is told to me, he said, "Really?" To which my response would have been, "Read the damn law." Honestly, it feels good to say it. Will you say it one time with me? Here we go. 1, 2, 3. Read the damn law. So then you know what he said? He said, wow, maybe we need to make some tweaks. And I do know that one of the Walmart people said, it's going to take a little bit more than a few tweaks. Did you know that members of my coalition have met with Senator Harkin 4 times? Deja vu. Every single time, the purpose of the discussion is about exchanges, navigators, and the role that agents will play. And every single time, he said this. What are you worried about? You guys should just be navigators. No, we are specifically prohibited by the law from being navigators. And oh, by the way, if we were, we'd be specifically prohibited from getting paid. So I get that you want us all to be volunteers, but no, that's not a solution. And usually he looks at his staff members and, is that true? No, that's true. Read the damn law. The law reforms 1/6 of the U.S. economy. Have we ever passed a more impactful law with less relevant debate and less understanding of its true impact than this? God help us. So now we've talked some about where we've been, and hopefully you've seen that GBL has been an active participant in the debate, arguing with and for you. Where are we now? God help us, we're spinning in circles. Okay, so the Supreme Court decision came down. I'll break this down, it's pretty easy. A lot of stuff, blah, 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 Supreme Court. Okay, so the number one thing they were arguing about is the individual mandate constitutional? Did you know that the government lawyers spent 90% of their time trying to prove that it was constitutional based on the Commerce Clause? It was almost a throwaway thing that they said, oh, and it's a tax too, so we can do that. And the level of the rhetoric that the government lawyer, I mean, no wonder the Supreme Court was persuaded by the brilliance of their oratory. I have a sample, and I'm not making this up.
Insurance has become the predominant means of paying for health care in this country. Insurance has become the predominant means of paying for health care in this country because because this is a market in which although for excuse me.
Well, you can certainly see why. Given the strength of the argument, that the Supreme Court ruled in favor of the individual mandate, not as an exercise of the Congress's Commerce Clause, but because Congress has the ability to tax us all. Hey, are you an optimist, Janice? Do you like to see the glass half full? Here's something to think about. We're $16 trillion in debt. Thank God Congress can tax us any way they want. Another 4 years of this, they'll have to. I have a sophomore daughter. She's a smart gal. She asked me, Dad, what you take a foreign language in high school? What should I take? I said, Chinese. I said, that way you can visit the money you will be earning as an adult. Because it won't be here. So they upheld the individual mandate. I think this is funny. They might have to rewrite the law because it describes it as a penalty. So we should probably do a find and replace, and everywhere it says penalty, it's now. And the president is excited that it's excited. Okay, they looked at one other thing, and I think this is important as you understand, in order to understand the debate around Medicare. The law was requiring states to expand Medicare, but the Supreme Court said they can't require it. It's still part of the law, but if you as a state want to not expand Medicare, you can do so without having a threat to your current funding. So it's optional. And a lot of states, Iowa among them, are not expanding, even though the government's enticing them with lots of money to do that, because at the end of the day, those expansions won't be paid for. and we're worried about how we would pay it. So here, where are we now? We might as well look at the law itself. Let's remind ourselves a few things. Number one, it's 2,700 pages long, although it depends on the size of the font you use. You can make it shorter or longer. We thought it would be 7 to 10 years of rulemaking. They better get going. Got about 10% of what we should have right now. Experts believe it will require more than 100,000 pages of guidance be issued by no fewer than 7 different federal agencies in order to know how to do the law. We don't know yet. It's stunning to consider what we don't know now. There are many questions that can't be answered. This is really important stuff. The CBO score, it's going to cost $1 trillion, right? Famously, it will reduce the deficit. Magically, it will spend $1 trillion, reduce. That's good stuff. How does it do that? Well, it's a huge tax increase, close to $500 billion, whatever it is. And $715 billion in projected savings from Medicare. That's a fact. I cannot believe the amount of misinformation in the media about what's going on with Medicare. I would like to right a few wrongs today. So before we do that, let's ask ourselves in the past, how good have we been at predicting the cost of significant health care legislation? Not very good. In '67, we thought that Part B would cost $12 billion by '90. It actually cost $100 billion. So we were off by 800%. What if we're off that far now? Who's a math guy? What comes after $1 trillion? Is it quadrillion? We'll need that number to calculate the debt. God help us if we're as wrong as we've been in the past. I want to talk about Medicare. This is important. Here's basically how this works. Did you know that in 1997 we passed a law called the Balanced Budget Amendment? And basically what it was going to do was slow the rate of increase of Medicare spending by reducing the amount that we reimbursed to providers. Yeah, but we never did. They never did that. It's never been enacted. So what does the President's health care plan do? It puts all of those reductions back in immediately. That's the plan to save Medicare. It is, in fact, a cut from Medicare in the amount of $715 billion. Medicare's own actuaries believe that if you do that, 40% of providers will either go broke or quit seeing Medicare patients. I suppose you could argue that will impact the quality of care. But maybe it's just easier to live in fantasy land. This is the worst part ever. This is the dirtiest accounting trick you're going to ever hear about, and it's happening to you and me and the entire country right now. You want to cut $715 billion from Medicare? Good. Great. Maybe half the doctors will go broke, but whatever, you're going to do something. But don't count it twice. Don't, out of one side of your mouth, say, we've saved Medicare. We're extending the life of Medicare, and then take that same $715 billion and use it to fund your massive new subsidy over here. That's cheating. I wish I got to debate the president. I would explain that. There's a great YouTube video. You should watch it. Kathleen Sebelius, my new latest favorite government employee, being asked by a member of Congress, well, wait a second, you can't count it twice. Are you using that money to save Medicare, or are you using it to fund health care reform? And she looked right at him and said, both. So apparently the rules just don't apply. That's what's going on with Medicare. And if you're wondering what the president's plan about Medicare is, the vice president he was going to actually do some of the same cuts, but Romney says no. He's going to create a voucher system and actually do means testing. Meaning if you make more money, you have to pay more for your Medicare. Can you believe that's the reality versus what you're hearing? I find it, boy, I guess I find it funny. All right, I'd like to have a conversation with you about the cost of laws. Here's what people don't get. Laws cost money. And I get it. The CBO scores a bill and says it's going to cost whatever. That doesn't even begin to approach it. Anybody remember Y2K? Remember Y2K? It's a big deal. I think all the taxis were going to run backwards, or the buildings were, whatever it is. I was serving at Blue Cross at the time on the Y2K committee, given my amazing IT skills. And we had to refigure all the the mainframe code and all of that, and make sure we didn't blow up and all. And it cost us $2 million. It wasn't a lot, it was just a thing. But that cost us $2 million. And I thought we did it pretty well. Nothing blew up, does it? So you think something went right. So, do you guys remember HIPAA?
Yep.
I was on the HIPAA team too. That made Y2K look easy. Laws have costs. You cannot believe how many employees and how many meetings and how many IT refigure this, do that, Blue Cross had to go through in order to comply with HIPAA. These aren't costs captured by the CBO. These are real costs spent by businesses in order to comply with laws. Want to take a guess? $20 million. That's what it cost us at Blue Cross. Who paid that, by the way?
Customers.
Yeah. Went right into premiums. Blue Cross, let's do some math. There's some math in my head here. Blue Cross has 2 million customers, cost $20 million. Let's see, at the time, there were 260 million people who had insurance, health insurance in the country. I cheated, Dustin. I did the math in advance. Let's see. So my estimate of the cost to implement HIPAA is that it costs $2.6 billion, and that's just out of the gate. That's none of the ongoing costs. HIPAA, that's nothing. Try the Affordable Care Act out for one time. My feeble brain cannot even begin to contemplate how much the total bill will be. But let's look at two relatively insignificant components. You guys heard about the rebates? Rebate deal. Now, if the carriers don't hit their MLR requirements, you gotta give money back. In Iowa, one carrier, it was UHC of the River Valley, had to pay a rebate. Not the main UHC, UHC of the River Valley. And guess what? They had to pay a very small amount of rebates to a small number of customers. Probably you weren't even aware of it. But did you know that the law requires every carrier to send every member a letter telling them that they, in most cases, got no rebate? That's great. Let's use Blue Cross as an example again. They have 2 million members. So they sent 2 million letters telling people they didn't qualify for a rebate that they probably didn't know existed. That sounds like a great use of money. And guess who paid for that? Their clients. Do you know how much it costs to send a letter? If you're a company, you've got IT costs. You've got lawyers who have to review things. You've got to print it. You've got to stick it in an envelope with your fancy logo on it. You've got to mail it. And then you better have staffed up customer service. Because now you've got 100,000 phone calls. And in the customer service world, volume is a bad thing. And in the real world, we have to pay those people to answer the phone. I don't know what it costs. They don't tell me anymore. I don't know what it cost Blue Cross and Blue Shield to send that letter, but I'll guess it was at least $1 million. How many letters got sent in the country? Oh, I don't know, 300 million. How much did we spend telling people they did? I'll bet we spent more than the total value of the rebates. Wow, that's a great use of our time and energy. I bet that lowers costs somehow. Do you suppose? That was one example. Now we've addressed one page in the law. Here's another page in the law. Did you know that in March of this year, all employers will be required to send all of their employees a letter saying, hey, there's going to be an exchange, and you might be eligible for a subsidy. Now keep in mind that in March, we won't know if there will be an exchange, and we certainly won't know who is eligible for subsidies. And yet we've got to tell everybody. I wonder what that will cost. Okay, so every single employer in every single state across the entire country has to send these letters, and then I don't know how many phone calls are going to happen. And again, you've got attorneys, IT costs. I have no idea what that costs, but now we've only got 2 pages of the law figured out. I'll bet if we sat here all day, we could come up with $1 trillion in additional costs that this law creates that is not scored by the CEO, but is ignored in the fantasy land that is the government that passes laws without any thought or concern about the consequence to businesses or clients. You just remember that the next time somebody tells you how much this law costs, because I can guarantee you they're way off. Not that I'm bitter about it. Joe, does it seem like I'm bitter? All right. So we've looked at where we've been. We've looked a little bit at where we are. Now let's talk about where we are going. And let's make sure we choose the right destination. This is big deal stuff. You're wondering what's going on with exchanges. This is a really, boy, it's fluid, man. You don't know. Here's the deal. There's this election. Maybe you've heard. I suggest you vote. Maybe have your friends vote too. I can tell you that at the governor's office, they're really watching that very carefully because depending on who gets elected, they may or may not file an extension. We have until sometime in November to let the federal government know whether or not we're going to do a state-based exchange. If President Obama is re-elected, I think it's 50-50, honestly. But I think there's a pretty decent chance we'll file an extension and try to do a state-based exchange. Maybe that would be better. Maybe in a Machiavellian way, we'll keep our enemy close. We'd probably rather have that than what the feds might do to us. What I cannot answer for you at all is what that would look like. At a very fundamental level, a healthcare exchange will be where people go to figure out if they're eligible for a subsidy. Because they're going to look at your income and decide. And that's going to happen in an exchange. Now what happens beyond that, I don't know. We're watching this closely. This is a big deal. You've seen the timeline. I mentioned this before. Soon you will see our step-by-step guide for employers. It's a difference maker because I think there are a lot of employers out there who will be saying things like, geez, my agent, he handed me that. What I really would like is some advice. And we'll help you provide that advice. I think it will be market leading and I think it will be superb. And that will be coming soon. And as I said, it will be a guided decision document for the employer. Here's another thing you need to be aware of, this summary of benefits and coverage. Basically, the way I see it, when I add it up and I look at all the different times, either a client, individual client or a group employee will be sent an SBC in any given year, it would appear to be about 50. Okay, maybe that's an exaggeration. Summary of benefits and coverage, which, by the way, these are like really long. I don't know, are they 12 pages or something like that? They're super long. You will have requirements as an agent to provide them at different times in the sales, enrollment, and renewal process. And you need to understand, you know why? There's a fine. Maybe it's a tax. I don't know. It's $1,000 per occurrence if you don't do it. And I don't know what your commissions are these days, but that may not cover your $1,000 fine. So we'll be looking for emails from us about that, and we actually have some webinars teed up for next week even to make sure you're aware of what your responsibilities are, what your employer's responsibilities are in terms of distributing these SBCs, whether it's an individual client or a group client. Another thing that's happening right now you need to be aware of is this FSA medical limit of $2,500. You might be asking yourself, wait a second, I've got groups that are going to be moving with their coverage into 2013. And we do have it confirmed that this only applies for plan years that begin in 2013. It's on the timeline. It'll be in the other document that we send out. But basically, the message is you've got to work with your groups and make sure they're complying with that restriction. I mentioned this before. By the way, I want to talk to you about subsidies. So you hear a lot about it. Who's eligible? I don't love it. Here's one thing I want you to think of. Because maybe you've heard, if you make less than 400% of the federal poverty level, you'll be eligible for a subsidy. And in Iowa, a family of four is like $90,000. Geez, a lot of people will be eligible for that subsidy. Not if they are employed somewhere that offers coverage. And here's why that is. There are actually two criteria you have to meet. The first is the 400% deal. But the next is that what your employer charges you for single coverage has to be greater than 9.5% of your family's income. And maybe you're doing quick math in your head. Guess what? If your only family income was your salary and it was $25,000, your employer would have to be charging you about $200 a month for single coverage in order for you to be eligible. I can guarantee you greater than 95% of folks who have coverage through an employer will not be eligible for subsidies. Why do I bring that up now? Because they're all going to be told about it. Great. That should be awesome. They can all ask questions about subsidies they won't be eligible for. Beginning in March, the government will tell us what these letters have to say, and they'll say, hey, there's going to be an exchange, and you might be eligible for a subsidy. And what we're recommending to folks, if you read our decision document that will come out in the timeline, is you can get in front of this issue and talk to your employers now and say, look, let me head this off. You're going to get a bunch of questions, and the answer to every one of them is going to be no. Because I've looked at your payroll, and I know that nobody will be eligible for a subsidy. But that's a more specific conversation we can have down the road. All right. You hear a lot about this. Wait a second. Do I have to offer coverage? Here's how that works. If you're an employer with more than 50 FTEs, yes, you do. If you don't, you will pay a tax, a penalty. It's crap. I can't keep it straight. What is it? Oh, it's penalty. Okay, great. You will pay a penalty if you don't provide minimum essential coverage for your employees. How much would that be? Survey says $2,000 per employee per year. You get to exempt the first 30. What if you have somebody who magically qualifies for a subsidy, leaves your plan, goes out to an exchange, gets a subsidy, and buys there? Well, that's not good. Then you're going to pay $250 a month for that, or $3,000 per year. At least out of the gate, I don't think too many employers will have to worry about that. I do think they may have to worry about the first one. What if you're a small group? You are not required to offer coverage if you're under 50. Okay? Supreme Court upheld the individual mandate. That means all of us must obtain coverage, or you will pay a tax. How much is the tax? Not very much right away. $95 or 1% of your income in year one, and it goes up from there. I think it's reasonable to assume that tax may not be a strong enough encouragement to a young, healthy person to begin paying what will be premiums that are probably double what they are today. Especially if they know, if something happens, they can just go get signed up. If that's indeed how it works. But that's something you need to worry about. Okay. I don't know if you guys are aware of this, but as I'm becoming aware of it, it's falling very much into the big deal category. Exchanges are permitted, and I suspect they will all do this, to have an open enrollment period in order to use an exchange and get coverage. What would be the dumbest thing they could do? What would be the absolutely catastrophically most stupid thing that a bureaucrat could do with respect to that annual election period? I don't know, make it the same as the Medicare annual election period? That would be really stupid. You'd have to be about brain dead to do that. So, needless to say, that's what they did. It's longer the first year. It like goes into March or so. And then it'll squeeze back down exact same dates as the Medicare AEP. We don't know how this will flesh out, but you better get on your horse during those 45 days, because that might be 90% of the health insurance you write that year, depending on what the carriers who are not on the exchange are doing. That's a big deal. We're chasing that down right now. Had you heard about that? So that's what's going on with that. We don't know if you're offering coverage out. Blue Cross, maybe Kelly will tell us when she speaks at 3:30 what Blue Cross is going to do. All right. So we've talked about where we're going, and we've talked about choosing your destination. And you have a to-do list. And we've been encouraging you to change reality, to not do everything the same way you've always done it. To let this day be the day that you changed your business in a way that not only helped you survive, but in fact thrive. How might you do that? Well, partner with us. We'll be there with you every step of the way. Use our healthcare reform tools to prospect new groups. We're going to have some really compelling questions you can use to go and say, Jesus, your agent talked to you about this? Because I know he's told you have to send those notices out, but did he tell you that none of your employees are going to be eligible? Did he tell you this? Did he tell you that? Oh, he didn't? Well, maybe we need to talk. You got to grow. These tools will help you grow. Absolutely. You have to layer ancillary products with all of your groups. If you're not doing that, I'm not sure what you're thinking. But we have a number of very high quality ancillary product vendors here with us today. Take the time to talk to them at a break and make sure you understand the products they have, because absolutely you can't leave money on the table. And if you don't have the conversation, someone else might. I don't know what will happen in the group market. Lots of smart people are saying lots of different things. Maybe small groups will get rid of coverage, who knows. But what I do know, and we're not going to encourage that, we'll help employers understand what their options are. But here's something to be thinking about right now. Use the tools that we will provide you to make sure that if a group decides to drop their coverage, that you become the agent for every one of those employees when they go out and get individual coverage. Okay, I get it, Mr. Employer, you're done. But the last thing you want to do is to send your employees, who you've always taken care of and always helped them make the decision, off into the wilderness on their own. We have a relationship. We know each other. You know how good I am. You know what I can do for them. Let's pick a day. I'll come in and enroll them all. If that is what happens with an employer. So we'll talk about that. The guy who's going to talk after me is Carl Lingen. This is game-changing shit. You ought to listen to Carl. Have you ever said to yourself, I don't have anything new to tell an employer? Because I got Coventry and UHC and Blue Cross, and I'm really good. They're really good. If you listen to Carl, you'll find out today there's a lot you can be telling a group that you haven't in the past. And the cool thing is, you don't have to be the expert, because Carl Lingen is an HR savant. Guy's a brain, man. So listen to what he has to say. You can earn more money from your existing client base You can also prospect new groups. I don't mean to steal your thunder, Carl, but put it on your to-do list. Make sure you're talking to Carl. Make sure you're expanding your product offerings. Easiest, simplest one, Delta Dental, over 65, nobody else. I mean, that's just one example. I could keep going. There's a lot of them. Here's another thing I hope you're thinking about today. And Ed Burke, God bless him, if we ever get him up here, he'll talk to you about this too. Not everyone, David Van On being the one possible exception, not everyone can be an expert in everything. And so if there are products that you don't know well, HR payroll, for example, but maybe long-term care, don't let the fact that you don't understand that market segment prevent you from making money in that market segment. I'm going to steal everybody's thunder. Ed Burke has made you guys this year somewhere close to $100,000 this year. Selling products, and all you had to do was give him the lead because it's not an area that you work with. That's called level 2. And if you're not doing it yet, I got to ask you why. Because it's an easy way to maximize your revenue from all of your clients. Heather, at the end of today, Stormy is going to talk to you about some about the marketing we do. I can guarantee you it's world-class stuff. Take advantage of our marketing I love our press release service. If you're an agent who's involved, maybe raise your hand or something. There's newsworthy stuff, man. We send press releases to like 100 different newspapers in the state whenever that happens. And we feature the agent. And then it runs. And the agent is considered the expert in the town. And then people they don't know pick up the phone and call them. It's that kind of stuff. And finally, stay involved in the debate. We'll try to help narrow your focus. Because we'll know when the chips are down as it relates to exchanges and all of that. I have a final thing to say. I think, honestly, 50 years from now, okay, maybe I'll still be around. 50 years from now, they'll look back at this time in history. And they'll say to themselves, those people had a problem because healthcare costs were too high. And they tried to solve that problem by passing 2,700 pages of insurance law. How stupid was that? I have a friend, she says, you know, I don't like politics. I'm not going to get involved. I have a confession to make. I don't like politics either. Anybody who knows me very well knows that's true. I'd rather play with my kids, open a beer on a Saturday afternoon and watch college football. But when the status quo is a problem, if you're not working for a solution, you are part of the problem. If not us, then who? If not now, then when? Get involved. Yeah, it sucks some days. But we owe it to ourselves and to our clients. And God help us, we owe it to our kids to be involved. Thank you for your time today.